Let's jump right into today's explainer. We're diving into a deeply personal, really thought-provoking piece of writing today. It takes something that sounds pretty minor, just a routine surgery on a ring finger, and totally spins it into this profound exploration of human psychology, the hidden power dynamics in healthcare, and ultimately our relationship with mortality. It's actually incredible how a single moment of extreme physical vulnerability can just strip away all our daily distractions, right? It literally forces us to look at life with absolute crystal clarity. Today, we're going to unpack the harsh realities of being a patient, those unspoken power struggles happening right inside hospital rooms, and a completely mind-shifting perspective on what it actually means to give up.
So, if today was your last day on Earth, where would you want to be? It's a pretty heavy question. And the author of our source material was struck by this exact thought. But they weren't, sitting on some scenic mountaintop pondering life. They were lying flat on their back on an operating table, fully conscious under local anesthesia for that finger surgery I mentioned, just staring up at this sterile, featureless ceiling. The sheer, crushing weight of their own mortality just hit them out of nowhere.
And that brings us to this jarring realization. The author wrote, "Not in a hospital room, not at home, but ending my life in such a cold room would be incredibly lonely." In that moment of intense clarity, they finally deeply understood why so many of us desperately want to spend our final days at home. The physical contrast between a freezing, clinical operating room and the warm, familiar embrace of your own living room, it becomes viscerally apparent when you're lying there feeling completely, utterly exposed.
Section 1. The Operating Table Epiphany.
Undergoing surgery under local anesthesia is, well, it's a uniquely terrifying kind of intimacy. You're awake, you're completely aware, your mind is sharp, but a part of your body is entirely at the mercy of someone else's hands. Now imagine you're in that hyper-aware state and you hear your doctor sigh. The author describes his agonizing moment during the procedure when the surgeon let out just a small, subtle sigh, and instantly panic sets in. Did something go wrong? Was there a mistake? Because you're conscious but totally powerless, a simple exhalation of breath suddenly becomes this monumental event. It just perfectly captures the sheer panic of being at someone else's mercy.
This extreme vulnerability triggers a really fascinating psychological response. First off, there's that surreal sensation of knowing a scalpel is cutting into your body, yet feeling absolutely no physical pain. You just feel the pressure. For the author, this sparked a sudden, immense wave of gratitude for modern medicine. They literally lay there thinking about people in history who had to face surgery or torture without any anesthetics. Can you even imagine the unfathomable pain they must have endured? And yet, while you're protected from the physical pain, your emotional sensitivity dials up to 100. The author became hyper-aware of everything. The medical staff's tone, their subtle gestures, their bedside manner. They realized that when our agency is stripped away, we cling to every tiny social cue in the room.
Section 2. Managing medical relationships. Now, what's really interesting here is that the vulnerability of the operating room doesn't just magically vanish the second a surgery ends. It actually dictates how patients navigate the egos of the medical professionals treating them. There's a critical tactical difference here between flattery and respect. The author points out that when you're a patient, especially when you're facing long-term aftercare, the absolute last thing you want to do is agitate your doctor. Doctors are human, right? They have emotions, they have bad days, so how do you handle it? Well, the source suggests finding a sweet spot. It's not about groveling or just fawning over them. It's about demonstrating genuine respect for their technical skill while strategically protecting yourself. You tactfully manage their ego to make sure you get the best possible ongoing treatment. It's essentially a survival tactic, just disguised as politeness.
But there is definitely a dark side to this dynamic, which the author calls the sensei trap. In many cultures, and very prominently in the Japanese healthcare system that the source describes, doctors are constantly referred to as sensei, which is a title of deep reverence. The text notes that being surrounded by this constant deference can dangerously inflate a medical professional's ego. The author actually observed doctors acting pretty arrogantly toward the nurses. They noted that while doctors might sit at the absolute pinnacle of academic achievement, some of them really lack the basic human decency or interpersonal skills they'd need to succeed independently in private practice. It's a really fascinating look at how unquestioned authority can shape behavior.
Moving on to Section 3, Deciphering Hospital Reviews.
So, if the dynamic inside the hospital is this complex, how do we even choose where to place our trust before we walk through the front doors? Think about a 2-star rating on Google Maps. The author makes a brilliant point here. When you look at restaurant reviews, a low score might just mean, the soup was cold. But hospital reviews? Those are a matter of life and death, which makes it a much more severe ecosystem. Now, sure, large hospitals naturally have varied reviews because they see so many patients with so many different values.
However, the author warns that if a hospital is hovering around a 2-star average, that is a severe warning sign. You really have to read between the lines and try to imagine the kind of circumstances that actually drove someone to leave that rating in a medical context.
But what if you don't have a choice? What if the only clinic nearby is that 2-star hospital? The source gives us some highly actionable advice for advocating for yourself, which I absolutely love. First, educate yourself on your specific condition. Don't just be a passive participant in your own healthcare. Second, articulate your symptoms clearly and calmly. Having an emotional outburst is only going to work against you. Third, appeal tactfully to the doctor's conscience. Remind them of their duty without attacking their pride. And finally, keep detailed records of even minor discomforts so you can present clear, indisputable data. This is exactly how you take back your agency.
Let's look at Section 4, Life Inside the Ward. We're moving from the acute trauma of the operating room and the anxiety of outpatient care right into the reality of long-term recovery. We're stepping into life inside the hospital ward. Wake up at 6 a.m. for vitals, rounds at 10, treatments at 2, mandatory lights out at 9 p.m. The author actually compares this to living in a highly restrictive apartment complex. Even if you have your smartphone and a nice view out the window, that rigid, oppressive schedule just strips away your personal freedom. That beautiful view quickly becomes mundane, and the lack of autonomy creates this deep sense of psychological suffocation. You can't truly relax when your life is entirely regimented by someone else's clock.
And within this restrictive environment, human relationships take on a completely different intensity. The text explains that the mere exposure effect, combined with the comfort of being cared for, can actually lead patients to develop romantic feelings. It's a fascinating psychological phenomenon. Vulnerable, lonely patients, especially the elderly, often develop these deep dependencies or romantic attachments to the nurses caring for them. Think about it. When you're totally isolated and someone is consistently showing you kindness and physical care, your brain naturally forms a really powerful and sometimes misplaced emotional bond. But as you can imagine, this creates a massive friction point: patient morale versus nurse exhaustion. On one hand, this emotional connection and the joy of interacting with the staff provides vital emotional nutrition for the patient. It genuinely aids in their physical healing. But on the other side, the nursing staff. For nurses, constantly fielding these heavy emotional dependencies and misplaced romantic feelings is just utterly exhausting. The author realized that nurses are often forced to develop a tough, sometimes hardened exterior simply to survive the emotional toll of their jobs day in and day out.
Bringing us to Section 5, Acceptance versus Giving Up. As the author processed all of this, the surgery, the doctors, the ward, they zoomed all the way out to a macro-level philosophical truth. It's really about redefining how we view resilience. Consider the Japanese concept of akaramero, which translates to giving up. Now, we usually think of giving up as a failure, right? But the author argues that giving up is actually the ultimate form of acknowledging and completely accepting what is forever lost. If you're physically disabled and you're genuinely smiling, it's because you have truly given up on your old body. You have accepted the new reality. Conversely, if you're still fighting, still trying to recover, and still angry about your loss, it means you haven't truly accepted reality yet. You haven't truly given up. This nuance completely changes how we should support people who are suffering. Comforting someone who is still actively fighting to recover can actually backfire and spark immense anger. Why? Because misplaced sympathy just makes them feel pitied. The author also warns heavily against the toxic savior complex. There are bystanders who become almost intoxicated by the act of helping the weak, and if the patient rejects their help, these saviors get angry. Even darker, the text notes that some individuals secretly fixate on the misfortune of others. They cling to anniversaries of tragedies because, subconsciously, it makes them feel superior. We really have to be incredibly careful about our own motives when we offer help.
Which brings us to our final point, and a question I want you to take with you today. When you look at your own losses, are you still fighting a ghost, or have you truly accepted reality? This explainer started with a simple finger surgery, but it leaves us here, examining the very core of our emotional resilience. Whether it's navigating the terrifying vulnerability of a hospital, tactfully managing the egos of those in power, or facing our own unrecoverable losses, true strength might just lie in our ability to clearly see reality and finally, peacefully accept it. Thank you so much for joining me to explore these incredible insights, and I'll see you in the next explainer.